mental health crisis.
Anxiety among our kids is at an all-time high.
Record levels of violence, depression, and suicide.
About half of American kids with mental health issues do not get treatment.
An increasing number of families are turning to local emergency departments for help with a child experiencing a mental health crisis.
Suicide was a second leading cause of death among young children and teens.
This is an urgent scenario right now.
Suicide is the second leading cause of death between kids 10 and young adults age 24. But it's really the young adolescents, 10 to 14, that really have the highest risk among that group. It's led to the Surgeon General describing this as an emergency for the United States and for the American Academy of Pediatrics and the American Academy of Child and Adolescent Psychiatry to both come out and say this is a national crisis that we all have to tackle.
At first, I thought it was just growing pains, but I soon realized it was much more.
I found a bag of pills and a suicide note hidden. This wasn't a depressive episode. This was life or death.
St. Louis Children's Hospital has been a part of our community, serving the needs of our kids for over a century, and is recognized as one of the best children's hospitals in the country. But even with the best of care, the demand is too large.
It is really disheartening for all of us that treat children in St. Louis Children's Hospital with psychiatric disorders when we can't take care of them ourselves. We see them in the emergency room, we diagnose them, we know what they need, we spend time talking to their families, but then we have to send them somewhere else because our beds are full.
We had to take her to the hospital 3 times, and each time it was no less than a 17-hour wait for a bed.
We waited 3 days in the ER.
Last week, we had 16 children waiting in the emergency department to be seen at one time. And that's because we've had a significant decrease in the number of inpatient beds in the St. Louis community, at the same time that we've had this astronomical rise in mental health symptoms among youth and adolescents.
If I had to leave my child anywhere,
it was going to be at Children's Hospital.
KVC Missouri, a leading provider of children's mental health and child welfare services, and Children's Hospital are partnering to provide St. Louis and Webster Groves a place of expert care for children's mental health, giving the care that is desperately needed with a safe and secure hospital with only one focus: to help children and families in their time of crisis.
The benefit of being able to get quick, expert care for your child in your community is so rare and so needed. We hope that with a new facility, we will be able to provide care to all of the families that need it.
This campus is more than just a building. It's a place of hope for more than 4,000 youth per year. A children's mental health hospital dedicated to serving the mental health needs of children and their families. With this new facility, care can be near, lives could be saved, and families have a path forward.
I would be thrilled to have that kind of facility close by, and actually, I do live very close by. To have that continuum of intensive outpatient services and partial hospitalization services and several units for inpatient services is really the dream, to make sure that we're caring for the entire continuum along all of the ages and meeting the needs of the entire community.